We begin tonight with an issue THV 11 has been reporting on for years: maternal health care in Arkansas.
Today, that conversation took center stage once again as state leaders and medical professionals gather around the table together. THV 11's Brooke Buckner listened into that conversation, joins us with some of the biggest takeaways. Brooke?
Really, Faith, during the 2-hour discussion, Governor Sarah Huckabee Sanders and local doctors talked about how Arkansas needs more physicians and higher reimbursement rates to keep them here. While there is much more they want to improve, it's not an overnight fix, but they say today was a step in the right direction.
This is something that we can solve. We can do better than we are, and frankly, we have to.
That's why Governor Sarah Sanders, Senator John Boozman, and Congressman French Hill say they hosted this roundtable discussion.
Healthcare is really hard to navigate.
Because of its challenges, Dr. Nirvana Manning says they need to figure out a way to support mothers for the longer term.
The mom is the unit of all of that, and when she's falling apart, everything kind of falls apart. So we really need to assess ways that we can wrap around that mom.
We already provide that. We just do a really terrible job of actually transitioning people after that 60-day period. And that's something that I think could make a big, big difference.
Governor Sanders says having good partnerships with healthcare providers can be the solution as they find those patients and make sure they know what options are available and how to transition their coverage. From the state level, she says her team is looking at ways to improve reimbursement rates too.
It's a very complicated process, but the structure of the payment and what that looks like, and if there is a better way to do that so that we have more people engaging and more people staying in some of those communities, I think could make a real difference, particularly in a state like Arkansas.
Another topic of discussion, maternal mortality. Unfortunately, Dr. William Greenfield with the Department of Health says Arkansas ranks as one of the worst states for it.
Depending on the sources that you look at, we have been as low as 50 out of 50 states. We've been in the low 40s in other rankings. It's safe to say that we have an opportunity to improve regardless of which source you look at.
Dr. Greenfield says that's a big part of the conversation that needs to continue.
Ultimately, it's about improving the health and wellness for our families.
Dr. Greenfield also emphasized the need for mental health and nutrition support for postpartum mothers in rural parts of the state. We'll continue to follow these issues as conversations continue among state leaders.